Good morning. I'm Dr. Kelly Blasko, and I work for the Defense Health Agency, and I want to welcome you here to our Military One Source Facebook Live COVID update. I'm really excited today because we have with us today Dr. Catherine Witkop, who has worked really a lot with service women and around contraception. And we're having her here to talk about an app called Decide and Be Ready. But before we do that, I'd like to have you introduce yourself, Dr. Witkop.
Great, thank you so much, and thanks for having me. As Kelly mentioned, I'm Dr. Catherine Witkop. I'm a professor of OBGYN and preventive medicine at the Uniformed Services University for the Health Sciences, which is the military's medical school in Bethesda, Maryland. And as a preventive medicine physician and as an OBGYN, preventive services for women is something that's near and dear to my heart. And a lot of my clinical practice and my research interests have centered around preventive services for women. And included in that is contraceptive care and care for service women. I recently retired from the Air Force after 22 years in September of 2019. So I'm very familiar with many of the needs of service women. And as a proud veteran, I see it as one of my goals and missions to help service women deal with all of their healthcare needs over their lifespan when they're part of our military. Thank you.
Thank you, Catherine. It's really great to have you here. And, you know, the DHA has developed quite a few apps, mostly around behavioral health, but this was the first women's mobile app that was available. And so I just wanted to get started to ask you, how were you inspired to develop the Decide and Be Ready app?
Yeah, so because a large majority of women in the military are of childbearing age, part of our responsibility as healthcare providers for military women is to be sure they have access to information about family planning. And this includes preconception care or helping women be as healthy as possible when they decide to have children, information about contraceptive methods when the time is not quite right to have children, as well as resources for infertility if that becomes an issue at some point in their lives as well. In 2015, there was actually a paper in the medical literature that reported that the rate of unintended pregnancies or pregnancies that are either not planned or mistimed among military women was higher than among their civilian counterparts. And there are a lot of different potential reasons for this, but one of the factors could be that she was either someone who was not trying to conceive, was either not on a contraceptive method or it wasn't working for her. And so looking further into this, we learned that often service women don't always have the information they need or felt that they didn't have access to all the different methods. And there are a lot of methods out there. And decisions around contraceptive are what we call preference sensitive decisions. So your preference about a number of characteristics about a method are really important to selecting a method. And for example, well, one woman may care about effectiveness, and that may be the most important to her. Another woman might care most about side effects or being able to manage her menstrual cycles. And so the Decide and Be Ready app is a decision aid. A decision aid is something that helps facilitate what we call shared decision making between a patient and her provider. And basically, the app provides a lot of information about the app in a way she can understand. If you take a look at the app, there's a lot of graphs and diagrams that are really helpful to help the woman understand the details about the different methods. But then it asks her a series of questions about her preferences related to those characteristics. And therefore, she thinks about what is important to her, what is the most important thing to her about the decision. And then that way it promotes shared decision making. When she goes in to see her provider, they can make the decision together using all the relevant information. So it was a kind of combination of my interest in shared decision making and kind of patient-centered care and a real need that we identified among military women.
Yes, thank you. And I'm glad you mentioned about the preferences because I think each woman, servicewoman, has a unique situation. And like you said, they have life circumstances, ways that they want to be healthy or even know what the decisions they have to make. And they can often feel kind of alone or have misinformation. So maybe you could give us an example of a few situations that servicewomen may run into that might kind of go along with using decide and be ready.
No, that's perfect. So as you can imagine, service women face a number of unique situations. So one example is deployment. Our service women deploy sometimes to what we call austere locations where healthcare services may not be as available as in other places. Sometimes even the environment, so a very hot deployed setting may not be the best place to use a particular kind of birth control, for example, a patch. The patch is a particular type of birth control method that is can fall off in hot environments or when the service woman's sweating a lot. So that's just one example is when a woman is deploying to a particular location. The other really important thing that we've learned about service women is that when they're deployed, or even sometimes when they're at their home station, some of the requirements for their duty can make dealing with menstrual cycles a real challenge. And especially for those who have other medical conditions, for example, heavy menstrual bleeding, really heavy periods, or fibroids or endometriosis. There's a number of conditions that the birth control methods can help with and can really make a difference in a woman's quality of life. And what we found is that many women, now it's not all women, I mean, but many women have shared that they would like the option of skipping periods, especially when they're deployed or in particular work environments. This is called menstrual suppression, and it can actually be accomplished by using certain birth control methods, like, for example, taking the pill continuously or using a particular kind of intrauterine device that releases hormones. Skipping periods is safe, and in addition to improving quality of life or addressing medical issues, during deployment, it can be a really useful thing for women to do. And we've heard from service women that many of them want this option, but we've also heard that many of them don't know about the option until after they return from their deployment. So the app actually does tell a woman about these options and can help her think through which method might be best, for example, if she's about to deploy.
Yeah, I think that's really an important thing about this app is that although it's a decision making, not just for contraception, but it also serves our military. It's unique in that it's tailored towards service women and the types of situations that they face. One thing that I wanted to ask, I think you said that the app can support female service members, but are there other beneficiaries within the military that could be helpful with?
Absolutely. This is actually the app. It was designed with service women in mind by medical professionals, many of whom were or are current service members. But it was actually originally based on a decision aid that was developed for a civilian population. And I would say that although there is military specific information in the app can be used by anyone. It's available free, and we'll let you know afterwards how to download the app. But women who are not in the military can use it, and we really actually encourage that. So as a provider for all of our beneficiaries throughout the military health system, I would say that this information is the app is not only for service women, but for our teens out there who want to learn information. Many of them are dealing with all sorts of potentially medical issues or otherwise, and they want to learn information about different kinds of contraceptive methods. Spouses, really any of our beneficiaries, I would encourage to take a look and download the app. And hopefully many women will find it useful. I will say that it's actually, I would encourage men to take a look at the app too. either to become more informed about what contraceptive methods are out there. It does focus, the app does focus on prescription methods that service women may decide to use. There's a small section about contraception for men, but it's a useful tool to provide information that either that really anyone can use to inform themselves, to inform their partners, and to really empower our patients so that when they come in to see us in the clinic, they come armed with a fair amount of information up front. Providers who have used the app with patients, or providers who have had appointments with patients who have used the app, have shared that their conversation in the clinic, the clinical encounter, the visit is able to go into a level of detail about the different methods that may not otherwise be possible, because often a woman will come in already focused on maybe 2 or 3 methods that seem to be the most, the best fit based on what the app says. And so when they come in, they can really have a more patient-centered conversation. And again, this applies to everyone, service women, and all of our beneficiaries.
Yeah, and even as a psychologist, a lot of times the women I see do have questions. And obviously I'm not an OBGYN, so I can say, here's this app, and certainly go through it so that when you do see your provider, medical provider, that in fact you have this information. And I know, unfortunately, primary care physicians are very, very busy and don't always have enough time to do the education part and go through all the options. So I think this deepens that conversation, like you're saying, so that it can focus on meeting the needs of the service women and give enough time to answer any questions. So before we tell you how to find the app, do you have anything else you'd like to add, Catherine?
Well, it's exactly just kind of building off of what you just said. I think the goal is that it puts the information literally in the hands of the patient or the person. I don't even want to call them a patient, because much of the information in there is information that can be really useful for them in kind of all aspects of their lives. And so it puts the information literally in the hands of that individual. It's a personal and private way that the individual can kind of think through these options. This is a pretty it is a personal issue that often we find that a lot of our patients will go on the internet, for example, and try and pull down all kinds of information. As you know, that can be really tricky to know what information to trust, what not to trust. And so what we're really proud of with this app is that the information that's in there is based on the most up-to-date medical evidence. It's information that was, again, developed by medical professionals and service members. So our patients can actually trust that the information that's there is accurate. And then it can empower them, then, because of those questions that the app asks, it can empower them to come in, share those preferences, and have that deeper conversation with the provider. And there's a couple of other features of the app that I just want to highlight. One is once it comes down to the 2 or 3 methods that are probably best suited for the individual based on her answers to the questions, she has an opportunity actually to compare those two methods at a time, looking at a series of characteristics about the app. So she can see, on one screen, all the differences between 2 particular methods. And I think thinking through it in that way can be really helpful. She can actually, the output of the app can actually be downloaded as a PDF for her to keep for herself. It can be actually emailed to her provider. So the app uses the native functionality of the phone, either the iPhone or the Android. It's available for both, to then allow her to get that information to her provider however she wants. She can leave it on the app and bring it in. She can actually, email it to her provider. She can take notes in the app. The functionality to be able to take notes in the app while you're going through it is another feature. So really, all the features of the app and of this decision aid are designed to help the patient get lots of information, kind of sort through her preferences, and then be able to share that with her provider, and to really then, in that conversation, in that discussion, really get at that shared decision making, where the method that's ultimately selected is really based on both the scientific evidence as well as what's most important to her, and what she cares about the most.
Yeah, and you pointed out one thing that I wanted to highlight, was that we actually, in the development of the app, showed it to service women and got feedback on whether this was usable, did it make sense? So truly, it was a team effort to kind of, from all the perspectives, to make sure it was going to be really successful and helpful to our service women.
Yeah, and we actually added, as a result of that user testing in the development phase, we actually ended up adding several what we call information quickies, or little information pieces within the app. We added information about breastfeeding, what kind of contraceptives to use when you're breastfeeding, information about emergency contraception, information about more information. We had some, but even more information about the rhythm method. Some women, don't necessarily want to come in and get a prescription for contraception, but are more interested in natural family planning or the rhythm method. And there's information about that in the app as well. And we hope to, as we update the app, and the nice thing about mobile apps is that they can be fairly easily updated. And so as we update the app over time, we'll ensure that the information does remain accurate, and we will actually include more information based on feedback that we get from our service members. And
yeah, so
others.
yes, for everybody, it's free. So it's absolutely free to anybody. And where can we find it?
Sure. So it's actually available just like you find any other app. So I'd say the vast majority of people out there listening to this right now have a smartphone. So either with your iPhone, you go to the App Store, and for an Android phone, you go to Google Play. And in both situations, the best way to find it, the easiest way, is in the search box. Type in "Decide plus Be Ready." Oops. I think it's actually "Decide and Be Ready." It looks like the.
It has "Design and Be Ready." It should be "Decide." Oh
yeah,
my
there
goodness!
You go.
There you go.
There you go.
Oh my gosh.
No, it's okay. So if you type in just "Decide plus Be Ready," then you can easily find the app on either platform, and then download it. It takes about a second to download it, and then once, if you feel uncomfortable about having the information that you entered into the app on your phone, you can always just delete the app off your phone and the information just disappears. I know that is sometimes a concern with women in particular for issues related to their health, their personal health information. So I just want to make sure that folks understand that any answers to any of the questions, and they're more about lifestyle questions, less about medical questions, but any information they put in there is just on their phone. And then once they delete the app or reset the app, the information goes away.
Yeah, and I do know that when it's on your phone, it's encrypted. So also there's that level of protection. So, well, thank you so much today for sharing this today. I think it's very timely, can be used all the time, no matter what. And I will just put out a big plug. This is one of the best apps out there for service women, very applicable. And I just want to thank Dr. Catherine Witkop for joining us today and sharing this great resource. So,
thank you.
Yeah.
I appreciate the time.
So take care, everyone.